Let's listen in. By acknowledging the governor's announcement today to extend the moratorium on eviction foreclosure through October 17th. This is certainly an important step as we protect residents from and manage the economic impacts of this pandemic that we're dealing with. As a reminder, we have resources in the city of Boston for anyone struggling with housing. If you're having a hard time with your rent, you can connect to our Office of Housing Stability. And if your rent relief fund, we have a rent relief fund that continues to get funds to those who do not qualify for unemployment benefits. You can get connected by calling 311. If you're having a hard time with your mortgage or if you need help, you should reach out to your lender. I know there have been programs that banks have put forth here in the city of Boston, the Commonwealth. If you have an agreement with over a dozen, we have an agreement with over a dozen major lenders, and certainly that we want to be able to continue to create flexibility. The latest COVID-19 numbers in Massachusetts as of yesterday, 113,789 cases, a one-day increase of 255. Statewide, there have been 8,433 deaths. That's up by 2 from the previous day. The numbers combined, both the confirmed and the probable cases recorded by the state here. Boston's numbers, we have new numbers today. We have recorded 13,860 confirmed cases. That's just 4 new cases as of yesterday. 9,931 people are fully recovered. That's an increase of 33 from yesterday. And 722 people have passed away with no new deaths yesterday, which we're grateful for. And I want to all the people still suffering from COVID-19, the families suffering, we want to let you know that our thoughts and prayers are with you as your family member recovers from this illness and people recover from this illness. And also the families that lost loved ones, we want to know that how sorry we are here in the city of Boston. We continue to move forward curiously in step 1 of phase 3 of the state's reopening plan. Excuse me, cautiously, not curiously. It's kind of curious too. We're not sure when this is going to end, so I guess a little bit of both. We're watching the data close every single day. We're going to continue to do that. Our recovery metrics are still where they need to be as of today. For the week ending July 13th, our positive test rate was 2.1%. That's down from 2.5% last week. That's good news, and our job is to keep that trend going in the right direction. There is a clear cause and effect relationship between collective decisions, individual behaviors, and the spread of the virus. We certainly, we've talked about this several times here, and we're all watching on TV, watching what's happening in other cities and states throughout the country when science is ignored. So we are doing all what we must keep doing whenever we can to prevent the transmission and to prevent another surge from happening here. That's the foundation of our planning and of our economic recovery. So I will repeat what everyone needs to keep doing. We're going to continue to do this. Wear a face covering when you're out in the public, when you're walking around. We're asking you to keep the face covering on. As you're walking down the street or if you're going into a building, wear that face covering. We're asking you to keep 6 feet distance from other people, avoid large crowds. If you're walking down the street and you see large groups of people coming near you, we're asking you to kind of separate yourself from those groups. We ask people to continue to wash your hands with soap and warm water as often as possible. Continue to wash down the surfaces that are frequently touched, something that is really important to do. We're asking you to look and follow the public health guidelines for your place of work or business. Understanding the risks of infection before you proceed with any new activity. I think it's very important that folks that have not come back to work yet, in order to read the rules and regulations and understand what you need to do to keep yourself safe so that you can keep the people and the family members and people around you safe as well. We're asking you to take these steps to manage any risks that might be out there. That's why we have a 2.1% infection rate here in the city of Boston last week, because we continue to do. That's why we had only 4 new cases yesterday, quite honestly, because we're doing all the things that we have to do. If you have any concerns at all about exposure, my recommendation is you get tested. Testing is available right now in 20 different locations across the city of Boston. It's covered by insurance if you meet the state criteria. We've worked hard to support the sites that are free for all, whether you have symptoms or not. When I say 20 locations, most of those locations are health centers. Most neighborhoods in the city have a health center, so you contact the health centers to find out when you can get tested. We'll also work to bring mobile testing to communities and locations where access is an issue. Today, we're launching a new mobile testing team that will be operating for the next 3 months across the city of Boston in many different neighborhoods. It starts today at the Jackson Mann Community Center in Allston. Every 2 weeks, it will move to a different neighborhood. This is a dedicated citywide led effort to meet community needs and ensure that we are getting testing wherever there might be gaps in access or evidence of inequality. Allston Brighton is one of the lowest tested neighborhoods in the city of Boston, and that's why we're glad to start the testing there today, and we'll be there for the next 2 weeks. This mobile testing team reflects our continued commitment to citywide testing access. It reflects our commitment to leading our recovery with a robust, equitable public health strategy. We're grateful for partnerships with East Boston Neighborhood Health Center to operate this program. To see what testing sites are open near you, you can either contact your health centers directly or check the map. We have a map online, boston.gov/coronavirus, or you can call 311 or call your healthcare provider. So there's many ways of access for finding out where testing can take place. This weekend and yesterday presented another challenge with the heat wave. We opened 20 BCYF, Boston Center for Youth and Family Centers, as public cooling areas, at 40% of building capacity for distancing needs. We did not see heavy use of those centers and did not come close to meeting the restricted capacity in those centers over this past weekend. But we were able to have them available for those that were in need. We encourage people that during the heat wave not be out in the middle of the day if at all possible. That's especially true for seniors and older Bostonians. And I encourage everyone to check on your elderly neighbors on these very hot days to make sure they're okay. Whether it's a knock on the door in person, wear a mask, or by a phone call, making sure that we continue physical distancing. But it's really important that we have done it in the past, always check on our elderly neighbors or people that are housebound. And it's very important that we continue to do it, even though we're in the midst of COVID, that we do it now. If you see anyone experiencing difficulty, we're asking you just to call 911 right away. Just get the call 911 and explain the situation to the medical folks on 911 so we can send the appropriate agencies out to help people. At the same time, we know that outdoor spaces are essential resources for fresh air, exercise, recreation, and mental health. We are working to expand those opportunities. I want to remind everyone, whether you're in the city park or you're at DCR Beach, you must and you should follow public health guidelines. Wear a face covering when near each other. Give at least 6 feet of space. Do not become part of a crowd. We saw pictures this weekend of the beaches in South Boston where that was not happening. And just as a reminder for folks, on the beach in South Boston, those that go there, many people sit on the M Street beach side. If you just go to the other side of the bathhouse, there is about a mile of beach that no one's using. You can go there and spread out in physical social distance and really be safe and keep yourself safe, quite honestly. With this in mind, I have some new updates and announcements about what's available moving forward. Starting tomorrow in the city of Boston, 2 outdoor swimming pools will be open to the public. They're the Clarity Pool in Charlestown and the Mirabella Pool in the North End, both operated by Boston Center for Youth and Families. Right now, the 16 indoor pools at the BCYF centers are open only for youth and summer programs. But we want to have outdoor pools available as an opportunity for cooling off and getting exercise as this summer continues on. Due to COVID-19, there are new protocols in place. Pool capacity will be 40% of normal capacity. That translates to about 75 people or fewer at a time in the pool. There'll be no walk-up admissions. You have to register for a time slot at boston.gov/BCYF-summer. That's boston.gov/BCYF/summer. Registrations will go live 24 hours before the following day session, so you're able to go and reserve a space for you and your family. Registration is open today for tomorrow's slots, so that's an example. So if you go on today, you'll be able to get times for tomorrow to go swimming. Sessions will be 90 minutes long, and you should only sign up for 1 session per day so that we give opportunities for other people to be able to use the pool. We allow 3 children under 12 are allowed per adult. When you register for a session, you'll be asked the COVID-19 screening questions. You'll be asked again when you arrive at the pool, so you'll be screened online and then you'll be screened in person when you show up. We're asking people to arrive dressed to swim because locker rooms and changing areas are closed. Restrooms will be accessible, however. We're asking you have to wear a face covering at all times, except when you're in the water. And we're asking people to keep 6 feet of distance between household groups. Again, it's about keeping you safe as you get to the pool. Cleaning and disinfecting will be done at the opening and closing time and between each swim session at our pools. A lot of hard work has gone into opening our pool safely, and we ask for everyone's cooperation to make this plan a success. Unlike other years, our BCYF programming this year includes the use of outdoor pools is completely free of charge, so it will not cost any family any money. That includes 181 classes and 300 programs for children and youth at our community centers. So far, over 700 young people have been registered for the BCYF programming, in addition to nearly 500 in our virtual teen program. There's still open slots, so you can register your child at boston.gov/BCYF summer. I can also give an update on our Healthy Street initiative. This is the work that we are doing using creative strategies to make public spaces safer during this pandemic and accelerating our long-term goals in a safe and healthy in transportation. I'm announcing that temporary bike lanes in several downtown and Back Bay locations are being completed today. These streets are connect neighborhood routes to downtown job centers. So we're working as we connect through the different neighborhoods to connect to downtown Boston. We want to make the commute for commuters safer and easier. In addition, a temporary lane reduction and bike lane will be installed Friday on Cummings Highway in Mattapan. And last night, we had a successful community meeting on planned redesign of Columbus Ave in Roxbury from Jackson Square through Eggleston Square down to Walnut Ave at Franklin Park. That builds on our work so far this summer, which includes 9 extended bus stops, 368 approved outdoor dining locations on sidewalks or on streets, 125 temporary food pickup zones, 23 temporary food truck locations alongside parks throughout the cities in our neighborhoods, now operating in different communities, in bus and bike lanes on Essex Street and Washington Street in Chinatown, improving commutes from Roxbury, the South End, Chinatown, and the downtown. This is the work of many different partners, including the Boston Transportation Department, Public Works, the Office of Economic Development, and most importantly, our local community and small businesses. And I want to thank everyone who made this possible moving forward. We're also working to make sure that our public spaces are accessible and accommodating to all our residents and visitors who come into the city. That's the goal of our Healthy Street program. Already, we've distributed 25 mobility ramps to restaurants for outdoor dining, with 150 more on the way. And as you might be able to hear in front of me, not right now, it's quiet, but the last couple of press conferences, we're working to redesign City Hall Plaza to make Boston's front yard accessible and inclusive for all. This is a significant time to be doing this work. This week marks the 30th anniversary of the Americans with Disabilities Act. In recognition of this milestone, tomorrow, Wednesday at 1 o'clock, we'll be holding a virtual rally. It's co-hosted by Boston Center for Independent Living and our Commission on Persons with Disabilities, led by our Commissioner, Kristen McCosh. We celebrate every year right here ADA Day. It's a profoundly important piece of legislation in the history of our nation. But as we all know, this year is different for a lot of things, and certainly different for that recognition. It's not only is the event being held virtually, we also have a new understanding of what it means to be an inclusive community and the work that we still have to do collectively. The Disabilities Commission is hard hit by the pandemic. We've seen how disabilities, health inequities, and systemic racism work together to create deep injustices to the quality of life basic well-being, and fundamental rights. So as Commissioner McCosh has said, this year we are focused on the progress that lies ahead, more than looking back on how far we've come. The theme of our event is equity, diversity, and inclusion. It focuses on ending job discrimination, increasing access to public buildings, and permanent housing, things that we believe in and will continue to invest in the City of Boston. You can go to boston.gov to find out how to participate in this virtual celebration tomorrow. Unfortunately, I have to continue to address the violence that we're seeing in the City of Boston. We had another tough weekend here in Boston. Among the incidents, we had a 16-year-old and a 17-year-old lose their lives to an act of gun violence. An 18-year-old is in critical condition after another incident. The Boston Police Department is asking the public's help in each of these investigations. If you know any information, you can give us information anonymously in the city. I want to make it clear that violence of any kind is certainly unacceptable in our communities. When young people are victims, it's especially devastating. I want our residents to know that we're focusing on resources on our most highly impacted communities in the city and on an ongoing basis and in response to specific events. This is a coordinated strategy. It brings together our Health and Human Services Cabinet, our Office of Public Safety, our SOAR street teams and workers at BCYF, in the neighborhood trauma teams, and the Boston Public Health Commission, the police department, our schools, as well as the Suffolk County District Attorney's Office, many state agencies, and all of our hospitals, and countless community partners like the Louis D. Brown Peace Institute and ROCA Boston. All of us and all of them organizations are working around the clock to reach young people and adults who are at risk and offer them pathways to safety and to opportunity. I just want to note to parents and grandparents, if you're concerned about a young person in your life, you can reach out for services without fear of judgment or punishment. Our neighborhood trauma teams are here for you. Our Office of Public Safety is here for you. Neighbors and advocates who have been through this struggle are here for you. You can call 311 to get connected. We want nothing more than to provide family support and youth opportunity to keep our young people safe here in the City of Boston. We want, above all else, to be safe and healthy in a city for every single child, teen, and adult to grow up in. Finally, I want to address an issue that's deeply troubling to Bostonians and Americans everywhere. We've seen the footage of unidentified federal officers aggressively detaining protesters in Portland, Oregon. We've heard the president say he's bringing that strategy to Chicago and to other cities. I want to express my support for Mayor Wheeler of Portland and Mayor Lightfoot of Chicago. They've made it very clear that these federal actions were not needed or wanted or invited into their cities. And while we have no information that Boston is being targeted, I want to make absolutely clear that behavior and that type of so-called help is not welcome here in the City of Boston. It's being done with no communication and working with no local elected or no public safety agency in those different cities. It's being done with no regard for the rights of safety of protesters, and it appears to be a needlessly escalating situation. Today, I signed on to a letter with Mayor Wheeler of Portland, Mayor Lightfoot of Chicago, Mayor Bottoms of Atlanta, Mayor Durkin of Seattle, Mayor Lucas of Kansas City, Mayor Bowser of D.C., asking the Justice Department and the Department of Homeland Security to withdraw these forces and end this strategy immediately. We are also sending a letter to Congress asking for public hearings on this issue. The language in the funding legislation would stop taxpayers' dollars being used for this purpose. In Boston, we support the movement for racial justice. We've built trust and solidarity with those who are demonstrating. And in Boston, demonstrators, with very few exceptions, have been peaceful. The people out marching are calling for the most fundamental right in our country was founded on. And the Boston Police Department has certainly preserved public safety while protecting the rights of free speech and free movement. Unfortunately, this seems to be another situation where the president who doesn't understand or believe in those rights. That's an unfortunate situation in the United States of America. but will continue to live by our values of inclusion and respect here in the city of Boston. And I will stand with my colleagues around the country. I have one question that was pre-submitted, and I'll open up for questions to the press. The first question I have is from Adam Riley at WGBH. What specific COVID metrics would cause you to pause the city's reopening or even roll it back? I just want to first say we're monitoring a range of metrics every day and certainly ready to make adjustments if the details call for it.